If you're in your 50s and you feel like you look tired, even when you're not, very often the upper eyelids are part of the reason. This is probably the most common early facial procedure I perform in patients in their 40s, 50s, and sometimes even younger. Patients will tell me, I'm sleeping fine, I feel good, but I look exhausted. Or they'll say, my makeup doesn't sit right anymore. I feel like my eyes look smaller. I look heavy in photos. And sometimes they don't even realize the eyelids are the issue. They just know something feels different. Upper eyelid aging is often the earliest visible change after 50. Let's talk about why that happens. There are three primary changes that occur. First, the skin loses elasticity. Skin in your 50s doesn't snap back the way it did in your 30s. Second, the brow can descend slightly, not dramatically, but subtly. But even a few millimeters matter around the eyes. Third, the upper eyelid skin begins to fold over the natural crease. That fold creates hooding, and hooding creates heaviness. Now, here's something important. Botox cannot remove excess eyelid skin. Botox is excellent for dynamic wrinkles. It softens crow's feet, it can slightly elevate the brow in certain patients, but it does not remove redundant skin. So when patients say, I've tried Botox, but I still feel heavy, that makes sense because the issue is structural, skin redundancy. Now, here's where diagnosis matters. Not every heavy eyelid is purely an eyelid problem. Sometimes the brow position can contribute significantly. So sometimes the eyelid problem is actually a brow position problem. If the brow has descended and we only remove eyelid skin, imbalance can occur. If the brow is stable and the issue is true skin redundancy, upper blepharoplasty alone can be beautifully effective. Let me give you a few typical patient examples. A woman in her early 50s told me, I don't want to look different. I just want my eyes back. That is the perfect mindset. Upper blepharoplasty is one of the most predictable and satisfying procedures we perform in this age group because the change is subtle but powerful. Upper eyelid surgery is subtle, but it can dramatically refresh your appearance, and it lasts 15 to 20 years. Now let's talk about what it actually involves. Upper blepharoplasty typically includes precise removal of redundant skin, sometimes conservative fat adjustment towards the corner of the eye. An incision is placed in the natural eyelid crease about 8 to 10 millimeters from our eyelash margin. We'll even those up. That incision is hidden in the fold when your eyes are open. The goal is not to change eye shape. The goal is to remove heaviness, not change identity. Over-resection is the enemy. Taking too much skin can create a hollow or tight appearance. Think Kenny Rogers. Taking too much fat can create a skeletal look. We call it cadaveric. Not good. In your 50s, especially conservative technique is critical. We want to be conservative. We don't want to be aggressive, but we also don't want to be ultra conservative, like a functional eyelid surgery where docs are just removing enough tissue just so you can see a little bit better. Okay, so there is a big difference there. You want refreshment, not exaggeration. Let's talk about something patients often don't expect. When excess skin rests on the lashes, it can subtly affect peripheral vision. Some patients don't realize how much their eyelids have been compensating after surgery. They'll say, I didn't realize how heavy my eyelids felt until that heaviness was gone. Sometimes patients don't realize how heavy their eyelids feel until the heaviness is gone. Now let's talk about recovery honestly. Most patients experience a little bit of swelling, some bruising, mild tightness. Stitches are typically removed around week 1. Our stitch goes back and forth underneath the skin, so you just see a little tiny piece on each corner. Bruising varies, usually is very minimal. Most patients feel socially comfortable very early. If you don't mind a little bit of swelling, you can, with your glasses or sunglasses, you can run around right away. The stitches, though, are removed around day 6 or day 7. And that's usually for women. If you want to wear makeup, you can start wearing makeup, but it's fairly minimal. Most patients are socially comfortable, though, within the first week or 2 weeks without being self-conscious. But here's something important. Even when you feel presentable at 2 weeks, subtle swelling can linger. I always tell patients every day, every week, every month, things continue to improve. That's just the way it is. Right away, you're very excited. It just keeps getting better and better and better for months. Don't judge your eyelid result at 2 weeks. Refinement continues. Eyelid tissue is delicate. It takes time for some of the swelling to settle and the scars to mature. By 6 weeks, most patients look very natural. By 3 months, refinement is clear. Now, let's address a common fear. What if I look surprised? That usually comes from over-removal of skin and over-elevation of the brow. We will not do that. With proper evaluation and conservative technique, that outcome is 100% avoidable. Conservative technique preserves natural expression. Another concern I hear, well, people know I had surgery. Here's what typically happens. People say you look rested, you look refreshed, you look great, your hair looks nice, something about what you're wearing. They do not say, oh my God, what did you do? The best upper bleph result is one no one can identify. Now let's talk candidacy. You may be a good candidate if you see hooding resting on your lashes, your eyes look smaller than they used to, makeup transfers because of excess skin, you look tired in photos even when you're not. But again, brow position must be evaluated. Everything is individualized. Now I want to address something emotional. The eyes are central to identity. Patients are often more nervous about eyelid surgery than they expect because it feels personal. The eyes are central to how we recognize ourselves. Subtlety matters tremendously here. Upper blepharoplasty in your 50s is usually about restoration, not reinvention. You still look like you, just more awake, more open, more aligned with your energy. If you're unsure whether or not eyelids or brow position are contributing to your heaviness, that's exactly what consultation is for. We evaluate structure, skin, brow position, and your goals. We offer both in-person and virtual nationwide consultations. Many patients travel to Cincinnati for natural eyelid rejuvenation, and we make the process organized and supportive from consultation through recovery. Upper blepharoplasty is often the gateway procedure in your 50s because it delivers powerful refreshment while preserving who you are. I'm a patient myself.